I'm Dr. Sreenivasa Murthy TM. So, how do we treat a tonsil infection? Again, we will have to see whether it is an infection which is acute, something which has happened in a day, two, whether it is been there for a longer time, or whether it is a recurrent problem. So, these are what will determine how we deal with a tonsil infection. Now, when a person comes to us and says, I'm having severe throat pain, fever, I'm unable to swallow, by and large, 9 out of 10 times, it would be a tonsil infection which we are dealing with. So, what would we do when such a person walks into our clinic? We confirm the infection by asking the patient to open the mouth. The moment we see the oral cavity, we get to know whether the tonsil is inflamed. When we say inflammation, the tonsil would have become swollen, it would have become red. Sometimes you can see a membrane on the tonsil. It's like people will come and tell us, doctor, when I open and see the mouth in the mirror, I'm seeing a white patch. So that is called a membrane. Sometimes you can have pus-like dots on the tonsil. That is what is called as follicular tonsillitis. Sometimes you can see something liquidy exudating, so that's called exudative tonsillitis. So these are the various ways we will be able to say whether the tonsil is infected or not. So then typically what I do is I take a swab for culture because I need to know whether it is a bacterial infection or not. On the first day when you present to the doctor, it is very difficult for us to say whether it is bacterial tonsillitis or a viral tonsillitis. So to that extent, taking a swab for culture tends to help us. Most often, first 48 hours, we treat patients symptomatically. That means we give patients something to control pain, control fever, ease out the discomfort that the patient has, suggest a diet which can easily consume. So obviously a patient who is having tonsillitis will be recommended warm, liquid, semi-solid diets. And then sometimes ask the patient to come back in 48 hours, see, reassess, re-evaluate, and then if required we start an antibiotic. Now if we have taken a culture swab, it tends to tell us which bacteria has affected, and then we can give culture driven antibiotics too. So it would mean that patient is either going to get only symptomatic treatment or an antibiotic is going to get added to it if we are suspecting bacterial infection. So question is, when does a doctor suggest that you need to undergo a tonsil surgery, which is called tonsillectomy? Now in today's world, have by and large restricted ourselves to be treating tonsils only when the size of the tonsil is very big, causing difficulty in breathing. That means it should be contributing to the patient having an obstructive sleep and labored breathing, especially during sleep. This would be an absolute indication. Now, which are the conditions we can have absolutely huge enlarged tonsils grade 4? We are looking at somebody who has been having a enlarged tonsils from childhood, it has carried on to the adulthood, and because of repeated infections, it will become bigger with every infection. Sometimes it can also be a manifestation of some tumor. In that situation too, we will be recommending tonsils to be removed. So if that is a suspicion that we see the patient with, then we will be recommending tonsillectomy. Now, other than these two situations where the tonsils are enlarged, most often all other indications would be for infection. Now, for infection, we have good medication. If the patient is happy taking medication every time they get an infection, we can manage them conservatively, or what we call as medical management. But then somebody is getting an infection every alternate month, and for 2-3 days every alternate month the patient or the person needs to take off from work or from school, then it becomes a little bit difficult for them both at workplace and at school. So there we have what is called as a relative indication. That means the person can actually live with such infections with medication, but because it is causing so much of problem multiple times in a year, we tend to recommend that the tonsil needs to be removed so that the patient will not have sick absenteeism. Usually when tonsils are removed in children, the average duration of recovery would be about a week, whereas the older the person is, recovery time becomes that much bit longer. Children tend to recover from tonsil surgery far earlier as compared to adults. Adults may take as long as 2 to 2.5 weeks to become absolute symptom-free after surgery, as compared to children who will be nearly symptom-free by the 7th day. So what are the risks and benefits of undergoing tonsillectomy? First, let us talk what are the risks of undergoing tonsillectomy. Now, tonsil is a very superficial structure in the oral cavity. It is not attached to any major organ, so which will lead to any major problem. But at the same time, because it is in the head and neck area, in the oral cavity, it has lot of vasculature. That is why wherever in the body there is increased amount of blood flow, the healing is also good. when we have any cut on the face, any ulcer in the oral cavity, they all tend to heal far more quickly as compared to any other part of the body. Similarly, as I was telling, oral cavity has a lot of blood supply. So, the one major risk that can happen during tonsillectomy surgery is about bleeding. Now, when can bleeding occur? It can occur either while we are performing surgery, it can occur immediately after the person has come out of surgery, and then it can also occur a few days after surgery. Now, this has been called as primary bleeding, reactionary bleeding, and secondary bleeding. Now, primary bleeding happens during surgery for various reasons, either because we are operating in a recently infected setting, supposing the patient had an infection a couple of weeks back, and then we end up doing surgery after the infection has subsided. We can anticipate that if the patient has had multiple infections, in this patient we will encounter some amount of bleeding more than what we encounter in other people. This we usually are able to handle because of the current technologies which are available at our disposal, and that shouldn't be a major concern. Reactionary bleeding happens because of after surgery, once the effect of anesthesia is worn out. Because of pain, there is an increase in heart rate, there is an increase in blood pressure, all of which will be controlled during anesthesia, and that can open up small blood vessels which might not have been evident during surgery. If that happens, then need to anesthetize the person again and then control the bleeding, and that is doable because the person is in the hospital setting very close to the operation theatre. Now, the secondary bleeding tends to happen 5 to 7 days after surgery. Now, this largely happens because of poor healing of the tonsil bed. Now, once we remove the tonsil, it's an open wound, and because it's an open wound, it tends to heal by what we call a secondary intention. That means we have to allow the mucosa to regrow on that area, and in that period, if the person is not following instructions as advised by the surgeon, it can get secondarily infected, or it can form what is called as granulation. In Kannada, it was like hunnu. Hunnu is something which is red, granular, that kind of thing can happen, and these granulations will have blood vessels which are not very strong. So, even minor cough, change in pressure in the throat, like clearing the throat, can disrupt these blood vessels and cause secondary bleeding. And if such a thing happens, again we will need to take the person into the operation theatre under anesthesia and then gain control. So, biggest risk is about bleeding. Now, how do we control all this? During surgery, we use equipment which we can reduce the amount of bleeding. We have some newer gadgets like coblation. We use electric current. We also can use laser. So, multiple such options are available for control of bleeding during surgery. Post-operatively, the secondary bleeding which can tend to occur, their parents will have to take care that the child eats the food which has been recommended, the way it has been recommended. So, to prevent secondary bleeding. But if it happens at least 2 or 3 times in a year. For the number of surgeries that we do, there will be at least 2 or 3 people in whom secondary bleeding can happen. And when such a situation happens, though unfortunate, it can be handled. It's not that it can't be handled. So, one suggestion that I make to all my patients who undergo surgery is not to leave the city where they have undergone surgery for at least a week after surgery. So, that way we can ensure that they are within the city where they have undergone the surgery. The doctor who has done the surgery will be aware of it and can handle the situation in case such a problem arises.